It's a drought-stricken morning time for us in New Zealand, in Auckland. And I'm going to give you a little bit of a taster of basically describe what our sustainability program is and what we've been doing since 2012. So the next slide, please. It just gives you the overview of the presentation. I'll start with the broader picture with health impacts of climate change, and then just work my way down that funnel to give you some examples of what we've been doing here, Counties Manukau District Health Board, or Counties Manukau Health in South Auckland. So I'm sure a few of you, if not most of you, have seen this slide. This diagram was developed by the Lancet Commission. It was released a few years ago actually now, but I often use this because I actually find it's a really, really good way of showing how direct and indirect effects of climate change as detailed here. When you add that into social dynamics, the health impacts are amplified. So as you can take an example, and I'd like to use this example, public health infrastructure, for instance, under the social dynamic column. If you think about a lot of our health infrastructure has not been designed with the changing climate in mind, and we've got a lot of old infrastructure. So we find ourselves in situations where if there's some extreme weather events, potentially our buildings cannot cope with that pressure, with extra pressure forced on us by the climate change. Then you add that to the actual increase in presentations through the doors through the emergency care department as a result of those changing climate, then it's just increases the demands on your scarce resources. So I think it's a really, really good place to start. And then the next slide, I have to confess this is my most flash slide that I'm going to use today. And this is from the CDC, and again, it kind of just really shows in a really lovely way how these impacts are going to have a great social impact on social and health outcomes. So you can see in the centre we've got the increasing levels of CO2 leading to rising temperatures, more extreme weather events, and rising sea levels, and how those impact on severe weather, which can lead to injuries and fatalities and mental health impacts. And you know, there's basically, it's a big powerful message there for us in the health service, where we're already constrained by resources in a constrained economic climate. And then the next slide, which was just, if we just park the whole climate change piece at the moment and think about our sector, the healthcare sector itself, we are a very high carbon sector. Healthcare is said to represent 3 to 8% of a nation's total GHG emissions. But of course, those of us working in healthcare realise that we may only contribute, it sounds like a small contribution, but actually our leadership and advocacy means we can actually impact much greater than those 3 to 8%. But when you think about our actual facilities, we're open 24/7 every single day of the year. We need to provide our patients with a healing environment. They have access to hot water and on the basic kind of needs. And climate change threatens those basic needs. So we're a very high carbon sector. We use a lot of utilities, water, electricity, and you see all the stuff that we use. We generate heaps of waste. Some of that waste is not necessarily recyclable because of the hazardous nature. So really, rapid decarbonisation is not only required, it is totally possible. And as many of you are probably working in health systems across the world where there's lots of activity going on. And actually, you know, the NHS in 2008, the UK, with the Climate Change Act, they started moving and decarbonising many, many years before we did in New Zealand. Excuse me, and there's certainly a lot of activity with the Global Green and Healthy Hospitals Network and the Healthier Hospitals Initiative, and there's so much going on, which is awesome to see, because we realise there are lots of savings out there, as well as health gains, enhancing quality, tackling equity, and building resilience. And the next slide, please. I kind of like using this slide as well. I actually found the pie chart on the right only recently, and I really like that representation, because quite often I'll hear people say within the clinical area or within the hospital or the clinic there's very little we can do. A lot of the emissions are within our buildings, and energy use are they're hamstrung with the travel options. They have to drive. So they feel disempowered, and a lot of the things are down to the stuff that we purchase and the things that we need. That's why the procurement piece of this, the pie chart on the left, is so large. But actually, if you break that down and think about that in a different way, the clinical side of things, actually, it shows you that clinicians and people working on the front line can have a great deal of impact on the carbon footprint of their facilities. And the estates actually account for a smaller amount. And this, hopefully, as we talk through the presentation, you'll see where I'm coming from with that argument. Next slide, please. So just to give you a bit of a taster of where I'm working. So I'm actually sitting in an office in the Middlemore Hospital at the moment. That's where my office is. We are the really large district health board, one of the largest in the country. We employ over 7,000 employees. Kids First Hospital and the Tiaho Mai, which is an acute mental health hospital, they're also at the Middlemore campus. And the Manukau Super Clinic, the second clinic identified in the diagram there at the top, that's one of our busiest outpatient clinics. And the Middlemore Hospital and the Manukau Super Clinic, they're the two sites that we actually measure our footprint for, because they accounted for over 90% of all the utilities costs, especially Middlemore. And actually all our freight is delivered to Middlemore, and a lot of it then is delivered to the other external sites. So we capture that activity in our footprint. But it's a pretty beautiful place, very diverse area in Auckland to work in and to live in. And the next slide will tell you a little bit more of our population. So we basically are a very, very fast-growing area, 1 to 2% more people every single year. 1 in 2 children, however, live in the most socioeconomically deprived areas. And actually, we've got 7 out of 10 adults are obese or overweight. So we're dealing with very sick and reasonably deprived community here. And we actually are the largest employer in South Auckland. We've got a really large number of old buildings, which has implications on many of our energy-related activities, and actually on the welfare and the well-being of staff and patients. So we do have quite complex issues to deal with here. As I mentioned, the area of high deprivation, we've got lots of food deserts and food swamps out there, which is obviously not going to help our obesity rates. Saying that, it's a very beautiful, vibrant and diverse community. Next slide, please. And we've actually been on our sustainability journey, which kind of really tied in with our strategy, wanting to be, provide health for everyone equally and tackling inequality. So our sustainability journey and philosophy fit very well with our strategy. So we actually began in 2012, and we measured our footprint using the Certified Emissions Measurement and Reduction Scheme. And we were the first health board in Australasia to do that. So we realised we needed to measure we needed to measure our footprint, our emissions, our carbon emissions and their equivalents, to be able to measure it and then manage it down. We thought that was a vital step, as was joining the Global Green and Healthy Hospitals Network in 2012. And through joining the Global Green and Healthy Hospitals Network, we connected with a lot of our international partners, and we were able to share and learn a great deal from them, especially in the early days. It was a vital step. We, at that point, established our governance structure, set up the work programme to tackle our emissions, and then obviously produced the strategy and policy and reporting mechanism. And we're sharing with you our latest results. So we measure our footprint every year, and so this is every fiscal year. So we got the results of our latest audit, which is externally audited annually, and that was the end of last year. And you can see that we've achieved a 26% carbon footprint reduction from baseline, which is our 2012 year. So we're really delighted with that. We did do very well last year, and I'll show you a little bit about our emissions in the next slide. You can see here we've got just details of our top 10 emissions. Of course, gas and electricity is going to be up there, as with everybody, unless they're passive. And they've got renewable energy on site, which we don't have. We're lucky we don't have coal boilers, but we rely heavily on gas and electricity for mostly our heating, ventilation and cooling. So you can see that's really up there. But despite that being so high, we've actually, through energy conservation projects, we've actually reduced our electricity consumption and made some quite considerable savings year in, year out. And having a dedicated energy manager working with us really helped them achieve those goals. I've also grouped together the air travel, which is work-related air travel. And as you can see, if you add all that up, that's quite a huge impact on our footprint. And through awareness raising programs, and plus with the global shifts and reduction in global air travel generally, along with some policy changes on how much education and leave health professionals can have, since we began in 2012, it's changed a lot because there's less money to go around the health service. So actually, people have got to think a lot more about where they go and how often. Plus, we've also got the teleconferencing technologies improved. So our air travel has tracked down over time. We don't tell people not to travel because people do have to travel, but it's to more raise awareness of the impact of business class versus economy class, and obviously where the value of offsetting comes in as well. So we've also been working on our fleet improvements. We've not got any hybrid or electric vehicles yet, but there is a plan to transition to that because the central government have set a target of all public organisations having a fully electric fleet by 2027. You also see nitrous oxide is very high up there, and that's with medical. That's mostly in obs and gynae, because of course labouring women require nitrous oxide for pain relief. But what isn't listed here is the other anaesthetic gases like desflurane and sevoflurane, which you've been doing a lot of work on, because desflurane is much more impactful than sevoflurane from an environmental point of view. And we've certainly, with the champion in the anaesthetic team, drove down with education awareness, drove down the use of desflurane in favour of sevoflurane. And waste is obviously one of our top 10, as it is for many large organisations, and we've done a lot of recycling and waste reduction projects. Do you want to move to our next slide? Thank you. So that's our next target. It's board approved, executive leadership team approved. We're going to be carbon neutral by 2050, which is in line with our New Zealand government target. But if you actually look at science-based targets, this is not early enough. If we want to keep global warming within the 1.5, if worse, 2-degree warming, then we need to achieve that before 2050, maybe 2030, at the latest 2040. So that's the discussion we're having at the moment with whether we need to reset that target. Next slide. So the focal areas we've been tackling, and as you'll probably recognise the diagrams of the GGHH target areas, it's basically working on the resilience of staff and buildings, trying to reduce the carbon impact, working a lot with our supply chain and procurement, working regionally as well as nationally, and just trying to think about contracts as they come up in the short term and trying to reach out to those far-reaching, longer-term, high-impact contracts such as waste. We've just had a really successful regional waste RFP, and we've got some excellent recycling offers in now as a result of that, so that's good. And then I've also put waste in because it's more about harm prevention. If you think about reducing waste, toxic waste to landfill, reducing transport-related emissions, and then actually if you're providing better food and less sugary drinks, for instance, on site, then you're preventing harm. So those are the kind of things that we've been looking at. So we couldn't do anything without engaging with staff, the people on the front line. There's absolutely no point, in my opinion, there is a point in having fantastic strategy and policy, but these need to be enacted. So you've got to get that connection right. You have to connect and talk to the people in the front line. And these are your change agents, and they drive all the change, and it comes from the service, and that's where we've had great successes with the formation of green teams and setting up networks. And honestly, the things that these guys do, it always never ceases to amaze me how fantastic they are, actually. But we're just trying to get it out with a range of internal communications, staff induction, and really targeting some messages for different areas, because there are common focal areas like waste reduction, but you do need to actually target that to the service. And next slide, I've nearly finished, a couple more slides. So this just kind of summarises the green teams in action, and that was from the Centre of Sustainable Healthcare, and we just kind of PDSA cycles, plan, do, study, act. And next slide. The next two slides just show you we've got a green team, really effective green team in emergency care called the Green ED, or Greened. And the next slide shows a picture of the critical care team's notice board, which was just to show everybody in the critical care team that what they can recycle, and it's a really strong visual image, and they recycle a whole heap. And then the next couple of slides basically shows you the green interest group activities. And it starts off with maybe recycling, but it just really does expand into all sorts of different wonderful things, as you can see there. They get involved in a lot of activities, even looking at their purchasing, and they reduce their linen intake, linen use and consumption, and basically set expectations of their peers around sustainability. So the benefits of sustainability in this next slide, as you can see there, I think there's many benefits of sustainable healthcare. Cost savings you have to obviously add, but it provides a transparent, credible way to track those costs and environmental savings. And then my final slide is a summary slide, because I think I'm just about in time. So we can and should play a vital role in rapid decarbonisation. We need to harness the energy and passion of employees, and the collaboration is key to success. And I've just got a links on my next slide and my contact details, and that's me. Thank you very much.
Good afternoon. This is Chris Qureshi speaking. Thank you, Debbie, for such a wonderful presentation. What I am going to speak with you today about is really to focus on what are the potential roles of nurses currently practicing in nursing, and what are their roles with assisting impacted populations with actual adaptation to climate change. Next slide, please. Now, Debbie already went over with us what the impacts of climate change on human health. What I would like to add is climate change is not going to go away during our lifetime. And the response to climate change really needs to have a two-pronged focus. One prong, which Debbie just spoke to us about, is how do we reduce and sort of slow down or hopefully halt factors that contribute to climate change, specifically global warming. However, we still have a situation where our environment has already been impacted and will continue to be impacted. And that actually is currently and will continue to impact health. Us as nurses need to recognize what are these changes and how are we as nurses going to be able to assist individuals and communities adapt to these changes, which are not going to go away anytime soon. Okay, so some of the things that we need to do really come from what the actual effects are on the local environment. And these include, as the impact occurs to the climate, we will see changes occur, such as new diseases, an increase or new types of injuries, changes in the social order, changes in the availability of resources, including water, food, and building materials, rising levels of individual, family, and community stress, as well as increasing frequency of natural disasters. We need to really learn how to provide care to patients who have encountered these new types of problems. Okay, so one of the things that we have already seen in the world is an increasing range of vector-borne diseases. Vector-borne refers to a disease that's transmitted from person to person through an animal, most frequently an insect. So things such as dengue fever, Zika, chikungunya, yellow fever, and Japanese equine encephalitis have actually increased its range. There used to be a band that went around the world that was called the Dengue Belt. And the Dengue Belt in maps from, say, 15, 20, 30 years ago would be much narrower from north to south. As global warming has occurred and weather patterns have changed and new areas have become wet, the dengue belt has actually widened, and cases of dengue fever, Zika, chikungunya, etc. are being experienced in locations and in environments where normally they had not been seen. Therefore, nurses really need to know how to recognize and report potential cases as well as care for individuals who have contracted these diseases. They also need to be able to deliver community education regarding vector control and self-protection for vector diseases. Next slide is now we're going to talk about it's not only hospital nurses that are involved in this type of endeavor. All nurses need to really have a good, sound understanding of public health and be able to speak about vector control with patients and the community. Okay. Now, with changing weather patterns, which is also coming along with climate change, you're going to see flooding in areas that previously hadn't seen flooding, or flooding at much more serious rates. But we're also seeing changes in the water supply. Some places are actually getting drier. So nurses need to understand how this disruption actually impacts health, and what kinds of patients are they going to be caring for. So the first thing they need to do is to assure their own personal and family preparedness. And then they need to go out and educate the communities that they serve regarding everyday disaster preparedness. They need to be able to recognize and report, as well as treat, diseases that might be seen related to flooding, such as tetanus, typhoid fever, hepatitis A, etc. Such diseases may have never been seen in communities before, but nurses need to know how to be on the lookout for them now. Okay, you also, with changing weather patterns, also see new types of injuries or increases in unusual types of injuries. So there are some countries in the world that are reporting changes in extremes of climate. So for instance, we just had visitors here in Hawaii from Japan who reported their winters are getting colder and their summers are getting hotter, and they are experiencing, on a population level, large numbers of cases of heat emergencies, such as heat exhaustion or heat stroke, and or as well as cold emergencies with a population that's not used to dealing with cold weather. Nurses need to very quickly learn how to take care of clients with these types of injuries that they usually have not seen before. So, as Debbie also mentioned, climate change also influences and changes the social order and social organization. And as the climate changes can erode the physical environment, the social environment also gets disrupted. And unfortunately, vulnerable populations and individuals in low-income communities and countries are usually more disproportionately affected when this type of damage occurs. Nurses need to be able to recognize when stressors are going on in a community. They need to actually have good de-escalation skills, because they're more likely to see highly stressed clients, and they have to know how to deal with them. And they have to also have a sound knowledge and abilities with relating to mental health treatment and or recognizing crisis and rapid referral. Okay, now with any type of climate change issue or changing weather pattern issues, you are likely also to see significant changes in the availability of resources. The incidence of working with fewer resources will likely increase. And especially, I think, in developed countries where nurses are used to having everything they need whenever it's needed, they're going to actually have to learn how to improvise and function in a lower resourced environment. Along with this comes now, do we have an understanding of what's considered ethical when resources become scarce or constrained or actually have to be rationed? Nurses need to be able to be flexible and identify acceptable workarounds before shortages occur, so that when these untoward events occur, they can rapidly take action. So how does nursing as a profession prepare to practice during this time of climate change? As I opened, climate change is not going away anytime in our lifetime. We can expect to see weather pattern changes, changes in resources and availability. So nurses in training, nursing schools really need to increase their content related to this topic. They need to include disaster nursing. They need to talk about altered standards of care. Emerging infectious diseases needs to be put into curriculum. Trauma nursing, public health, and mental health needs to be shored up. Accreditation bodies and licensing exam entities for professional nursing really need to require such content in each of these areas noted above. That will sort of drive the content in the schools. And practicing nurses hopefully would engage as lifelong learners and continue to develop knowledge and skills in each of these areas and stay abreast of new changes and developments. And most certainly all nurses have to have a family and personal preparedness plan. One cannot care for others if they have not yet cared for themselves. Next slide, please. So in closing, nursing as a profession cannot turn back climate change, but we can assist individuals, families, and communities with adaptation. We actually can advocate for climate change policy, and it seems as if in New Zealand, where Debbie is, nurses are actively engaged in climate change at organization and system level responses. Hopefully nurses can be engaged in conducting research to identify feasible and successful strategies for adaptation. And as the largest segment of the healthcare workforce, nursing can and should be leaders in the pathway for adaptation to changes related to what's going on in the world today. Thank you very much for your time and attention.
Okay, good day, everyone. I'm Jessica Madrid, president of the Canadian Association of Nurses for the Environment, or CANE. And before I begin, I'd like to acknowledge Sigma and Ani for their wonderful work in making this event possible, and gratitude to the previous speakers for their wonderful, insightful presentations, which is a great segue into what I have to say. And big thank you to our participants for their interest and concern today. So CANE was invited to give this presentation with the aim of getting nurses to see how they can lead within professional nursing organizations around climate change. And so with that in mind, I'm pleased to offer you the story of our organization and a little bit about the work that we do, in the hopes that you might feel a little bit more inspired, empowered, connected to what is really an international movement of nurses that are concerned about the very same issues that you are. So before speaking about CANE, I just wanted to take a moment to speak to the Canadian context, as I wanted to stress what Canada might have in common or how we might differ from other nations that might be represented in the webinar today. So as the slide notes, we are, of course, a very large nation with 13 provinces and territories and a population about 1/10 of the population of the US of A, or about the population of the state of California. We certainly have fewer nurses than the US of A, about 1/7 of the nursing population compared to our neighbors at the south. And this statistic reflects registered nurses, licensed practical nurses, nurse practitioners, registered psychiatric nurses. Of course, Canada is a super rich country in natural resources, and so not surprisingly, we are predominantly a resource and trade-based economy. And because of this, a lot of our ecological concerns or climate change challenges involve fossil fuel extraction, our infamous tar sands or bitumen extraction, fracking to obtain liquid natural gas and the associated refineries and pipelines. And of course, mineral extraction is huge in Canada, as well as forestry, which can both have enormous ecological footprints. So in Canada, we're losing our carbon sinks very quickly and experiencing a changing, unpredictable climate with extreme weather, storms, wildfires, droughts, floods. And the resulting epidemiology, I really credit Debbie and Chris for their presentations that had, of course, great summaries of that epidemiology, but of course, briefly summarize stress and other mental effects. Changing zoonotic disease patterns, illnesses of air, water, soil pollution, increasing food and housing insecurity. The list goes on, and of course, not the focus of my presentation, but credit to the previous presenters who got us thinking about those things a moment ago as well. So given the environmental concerns we face in Canada, of course, we find nurses who are concerned about these issues and see the links back to our work, both in health promotion efforts and in mitigating the footprint of the healthcare industry. And as this slide notes, in 2007, the CNA, or Canadian Nurses Association, or our equivalent of the ANA, put out a call for nurses to join a task force, so to speak, of nurses who were concerned about the environment. And at the time, I myself was working as a public health nurse in a small northern city. And let me tell you, my colleagues thought my interest in environmental health was a wee bit out of place. So even though at the time I had no prior experience working with the CNA or other nursing organizations, I was compelled to join this reference group because I was passionate about these issues. And to be honest, I so desperately wanted to connect with other nurses who were as well. And I knew that they must be out there. And so I joined this national reference group, which consisted of many nurses just like me, frontline nurses who were concerned about the same issues I was concerned about. Of course, we had several nurse academics, researchers within the group, as well as nurses involved in policy and program development. And I thought it was a beautifully diverse group. And by 2008, we outgrew our status as a reference group and became an organization, Canadian Nurses for Health and the Environment, or Infirmières pour la Santé et l'Environnement, because we are, of course, a bilingual nation in Canada. And a few years after that, we had the privilege of becoming one of the Canadian Nurses Association's 44 specialty interest groups. And most recently, in 2018, we underwent the slightly onerous process of a name change. We are now CANE, Canadian Association of Nurses for the Environment, but we believe that this new name is easier on the tongue and the memory, which of course are very important when building a movement. The next slide of my presentation, which speaks to our objectives, the objectives of CANE. And so the raison d'etre of our association, we have 12 objectives outlined in our constitution. And I've committed the classic PowerPoint sin of creating a slide that is very text heavy, but I wanted you all to be able to see exactly what we strive to be and do. And as you'll note in scanning that, networking, education, research, advocacy are all the hallmarks of our objectives, as well as an inclusion of all areas of nursing practice, individual agency, working with various structures. I also wanted to point out that as of last year, we've also included in our constitution statements that speak to intersectionality in our work, as we acknowledge that this ecological crisis that we're in, of course, doesn't occur in a vacuum, and nor will it be addressed in a vacuum. Environment where ecological health is deeply entrenched in systems of privilege, of exploitation, oppression, and without an appreciation for this and an openness to seeing our struggle and the struggles of others, we will never achieve our goals to the fullest. The lovely photograph on this slide is of our Alberta representative, or the province of Alberta representative, Maya, at a climate march last year. And I'll just have us stay on that slide for just a second if you care to scan through our objectives. So the additional brass tacks of our association are noted for you on this slide. We maintain an open membership that largely consists of registered nurses and student nurses. And as of last checking, we had 77 members and growing. We have a constitution and bylaws that govern our association, and they are subject to a periodic review. We have a working board of executive directors that is spread out across our very big nation, as well as 2 active subcommittees at present, which are open to our entire membership, where we work on project development, strategies, and actions. Our business is largely conducted through teleconferences, or more recently Zoom platforms. We utilize consensus-based decision-making in our endeavors, which is in line with our anti-oppression ethos. Our priorities are derived from annual strategic planning, usually stemming from our annual general meeting, as well as member-driven directives, whereby we're usually contacted by individuals or organizations who are interested in developing or partnering on given campaigns or projects. And the picture on this slide, we have 3 of our executive board members, Marilyn Tovar, Raluca Radu, and Wanda Martin, at a British Columbia Nurses Union event where CANE presented on climate change. So as noted in our objectives, the work of CANE is really about education or information sharing, resource development, advocacy, activism, and it's difficult to be successful in this type of work if you aren't open to working with others. And consequently, since our inception, a big part of the work that we've been doing has been relationship building with several health, environment, and nursing organizations. And this particular picture on the slide is of our second president, Hilda Sorsky, when we formalized our first formal partnership with the Canadian Coalition for Green Healthcare. And of course, on the slide, I've also listed some examples of our key partners and allies. So especially when you are a relatively small organization such as we are, it of course becomes essential to work in partnership so as to achieve critical masses, maximize resources, and of course, to not be reinventing the wheel. And I would imagine we can likely all relate to the frustration of spending a lot of time and resources in developing a project or resource, only to find out someone else has already done the work and perhaps better or more comprehensive than you did. So to offer an example, there is this great initiative called the Nurses Climate Challenge, which hopefully you are all participating in or aware of. Well, several CANE members were interested in joining this initiative, but understandably in Canada found it to be a little bit American-centric. So recently CANE approached ANIs to see if they would be willing to work together to hopefully make this amazing initiative pertinent to non-Americans. And to date, we've been delighted with ANI's receptiveness to begin these conversations and work with us. And so to highlight that instead of striving for partnership, CANE could have forged ahead and developed our whole own version of this project and invested all kinds of time and energy into this. But why? When time and energy are so precious and we do have this climate crisis, we need to, of course, be wise with our time and resources. And at the end of the day, we are a nursing organization, and because of this, I think we understand the importance of communication, and not just between individuals, but between systems. And this work is too important to become territorial or blinded by silos, and that is one of the reasons we included a statement about intersectionality in our Constitution. So I'm delighted to speak briefly about some more specific work that CANE has been doing. And here we have a great picture of our past president, Fiona Hanley, presenting on climate, health, and gender. Recently, we worked closely with the Canadian Nurses Association to disseminate a survey on eco-literacy to Canadian nurses. And this project is in the data analysis stage. Our past president, Jennifer Moran, is quite passionate and knowledgeable about the topic of eco-literacy, and it's always wonderful when someone in a group can translate passion and knowledge into action. And we're really looking forward to these research results because we obviously want to know where to direct our education and projects concerning environmental and ecological health. We've also been working with the Canadian Federation of Nurses Unions, and this represents a fairly new partnership for us. CANE executive member Wanda Martin co-authored their CFNU discussion paper on climate change, and we also are about to assist them in developing a brief course for nurses on climate change and green team toolkits. CANE has an education subcommittee, and here I'd like to acknowledge the long-standing work of Fiona Hanley and June Kaminsky, both past presidents and present executive members who continue to show incredible leadership in our group. And the subcommittee will be putting together a 2020 slate of webinars on ecological and environmental health topics. Here in Canada, the Canadian Nurses Association will have its biennial conference this year, and CANE has submitted abstracts to present on climate change, notably a Pecha Kucha that's meant to appeal to the heart and the importance of nursing engagement in ecological and environmental issues. The newly formed Centre for Sustainable Health Systems at the University of Toronto has also been keen to work with us, and we are pleased to be starting our collaborations with them, beginning with research that involves mapping out nursing opportunities for sustainability interventions. And as already noted, we hope to work further with ANIs on making the Nurses Climate Challenge something that Canadian nurses can be excited to sign on to. And as always, we're working on our relationships with several wonderful organizations, many of which were noted in this presentation, and individual Canadian nurses who contact us fairly regularly to support their work in education. So as I wrap up this presentation, I wanted to provide a slide that summarized some of CANE's successes, and I put this question out to our executive, and this is what we wanted to offer. So CANE has the honor and privilege of being situated under the Canadian Nurses Association banner and maintains a national network for advocacy in education. And I really want to stress that this has been no small accomplishment, given that, surprisingly enough, there are still many that don't see the connection between the environment, health, and nursing practice. And often controversial issues do fall under our umbrella and banner when you think about our nation being so entrenched in resource extraction. And it is because of CANE that the CNA has resolutions and position statements concerning ecological and environmental health topics. As noted, CANE maintains many relationships with key organizations, and we're always striving to network further. And lastly, mobilization and advocacy. Now more than ever, Kane's banner can increasingly be seen at marches and demonstrations. We also had a federal election last October in our country, and climate change was obviously a big election issue. Kane was heavily involved with the Parliament Hill call to action on climate change, and our own Fiona Hanley eloquently spoke on behalf of Kane and the CNA to elected officials and candidates on the subject of climate change and health. I will, of course, just take a moment to end with a very old quote from one of the co-founders of the ICN, Mary Agnes Nagley, where she stated, "Let us all remember that privilege means responsibility as we use our larger opportunities to make our country and the world better and brighter, purer and nobler with each succeeding year." I really appreciate this quote, which we have used in other Kane presentations, because it speaks to the privilege that we as Canadians and Americans, and of course all of us around the world, the privilege that we have and the corresponding responsibility that we have, not just to make our own countries better, but the whole world. And I do wholeheartedly believe that we are part of a paradigm or consciousness shift where we as humans are increasingly behaving like we're actually part of an ecosystem. And I, being a coastal dweller, see this paradigm shift like a wave, and I believe that nurses are wonderfully represented in the crest of this wave. And so with that, I thank you, Sigma, for supporting education on this topic, and I'd like to thank Ani for their hard work. We are so grateful for all that you do. And I would like to thank all of the participants and the other two speakers for their time and attention today. And I invite anyone to contact me directly if they do have questions.